Good afternoon, everybody. This is Dr. Bryan Wills, going to be live from Wills Chiropractic. Hope you guys are having a fantastic day. It's beautiful outside. Hope you get some vitamin D today. I want to continue our talk this month on some of those common things we see in the office. So we talked about low back pain and sciatica, neck pain. Today we're talking about headaches. Headaches are probably the most common thing that we'll ever see in our chiropractic office, and they're usually the most easy thing to take care of in the chiropractic office as well. One of my biggest pet peeves is when I hear patients say, I only get the normal headaches. There is no such thing as normal headaches. Headaches are never, ever, ever normal. However, they are very, very common. A lot of people get them. Most of us, in fact, at one time or another have had a headache, whether it's been self-induced from too much fun on a Saturday night or from something else that's going on. But one time or another, we've all had headaches. But they're common. They're just never normal. Headaches are your body's way of telling you something is wrong. Most symptoms are, obviously, but especially with headaches. And you can medicate them, you can do all kinds of different things, but until you really figure out the cause of what's troubling you with the headaches, they're never going to go away. And a lot of times people get hooked on medications to kind of reduce them. That just ends up making them worse in the long run. So there's three main type of headaches people get. There's the tension headache, which obviously most of us have, that is caused basically from stress. Poor postures and things like that. Most of those headaches kind of wrap up behind your head and up over the top. We have migraines. Obviously, probably everyone knows what a migraine is. Usually you get some kind of aura where you'll see some kind of funky lights or shapes, and then you have kind of a severe headache there. You're very sensitive to light, sound, those types of things. And then you also have what's called cluster headaches. Cluster headaches are when you get multiple headaches throughout the day. Usually last from 15 minutes to kind of 3 hours, and they can last, a week, 2 weeks, 3 weeks, 3 months even. But you get them pretty much over and over and over and over again. And medication really does not help those at all because they're so short typically. You just got a quick burst of a headache. It's there for 30, 40 minutes, an hour, and then gone. So those are the three most common type of headaches. Now the way to treat headaches are pretty simple. Obviously, if you do have a headache, a cold compress either on the back of your neck or on your scalp will kind of help calm things down a little bit. You can also, I've done a little trick, taking a small hand towel and kind of rolling it up like a cigar and placing it under your neck and letting your head kind of traction back a little bit. That seems to work. If you have a loved one around, you can lay on your back and have them kind of just pull up on your head a little bit, kind of traction your head out. That will kind of stretch things out and make the headache kind of decrease a little bit. But the easiest way to do it is to figure out what's causing the headache, and that's coming into a chiropractic office, getting a complete examination, understanding what's going on, and then eliminating that problem. So the major cause of headaches is usually in the upper neck there, kind of the upper cervical spine, and the nerves that exit up there kind of control a lot of the head, neck, sinuses, all those types of things. And if there's misalignment up there will cause irritation to the nerves that come out there. Those nerves feed all the muscles and structures again of your head and your neck, which the irritated nerves irritate them, and when you irritate the muscles, they start spasming, so it just tightens things down more. So it irritates the nerves more, which irritates the muscles more, and it's like a ratchet. It just keeps getting tighter, tighter, and tighter, kind of choking your nervous system off a little bit. And the only way to get rid of that is kind of break that ratchet a little bit and free up the nervous system to function the way it's supposed to calm everything down. It was awesome. A couple weeks ago, we had a patient that came in, and he said that he had headaches basically every day for the last 10 years, and they've been pretty debilitating. He's had nerve blocks, he's had medications, all these different things. Took some x-rays of him, did an exam on him, and found out that his top part of his neck was a wreck. And we adjusted him. Within 2 or 3 adjustments, the headaches just completely stopped, and he hasn't had one in the last couple of weeks after having them almost every day for years on end there. So headaches really are debilitating. It's sad to see patients come in that are just hooked on opioids or medications that they're constantly taking every single day to get rid of them. Again, doing nerve blocks, Botox injections. I mean, anything they can figure out to pump into, they do. And again, 90% of the time, those things aren't going to work. You need to figure out what the cause of the problem is, which again is always in that upper neck area there. So if you guys are suffering from headaches, please call the office here. Again, they are very, very easy to get rid of typically. It just takes a little bit of time to figure out what's causing them and eliminate that, and things are good to go there. So hopefully you guys find that helpful. Next week we'll kind of continue on with some other common things that we see. But again, enjoy your Wednesday, and we'll see y'all soon.